Cancer also loves an environment where there's no oxygen. Cancer thrives in an acid environment. On the other hand, let's make a list of what cancer hates. And if cancer hates this is what we want to give to the body. Cancer hates no glucose. And cancer hates oxygen. The fact is, cancer cannot live in the presence of oxygen. And cancer hates an alkaline environment.
Could you ever have imagined that just oxygen is enough to fight cancer? Proper breathing techniques can enhance oxygen levels in your body, potentially increasing cancer-fighting properties by up to 50%. In her groundbreaking approach, Barbara O'Neill reveals 5 transformative oxygen secrets that harness the power of breath to bolster your health. These techniques not only optimize oxygen intake, but also promote cellular repair and rejuvenation, creating an inhospitable environment for cancer cells. In this video, we will check out how simple adjustments to your breathing can lead to profound health benefits and longevity. Practice nose breathing exclusively. Let's begin with nose breathing, which is often overlooked in contemporary discussions about health and wellness. It offers significant physiological advantages that can profoundly influence overall well-being.
Now, there is a way to help yourself become a nose breather, and that's tape up your mouth. Now, you don't have to tape it up like this. And the idea is you just put a little bit of tape under the nose to the chin. And you do that for 1 hour a day for a week, and then you can sleep with it overnight. Yes, snoring and sleep apnea would almost be a thing of the past if these simple things were done. There is a famous professor named Professor Buteyko. I don't know if you've heard of the Buteyko method of breathing. He has passed now. He's a Russian professor, but he discovered that if he got his patients to breathe slowly and deeply through their nose, they could control asthma attacks.
Primarily, the nasal passages serve as natural filters for the air we inhale, effectively trapping dust, allergens, and pathogens before they can enter the lungs. This filtration process is essential in reducing the risk of respiratory infections and promoting lung health. Plus, the anatomy of the nasal cavity, with its intricate structure, facilitates the warming and humidification of incoming air. This is particularly beneficial in cold or dry environments, as it ensures that the air reaching the lungs is at an optimal temperature and moisture level, which enhances the efficiency of gas exchange. When air is inhaled through the nose, it passes through the nasal turbinates, bony structures lined with mucous membranes, where it is warmed and humidified. This conditioning of air not only protects the delicate tissues of the lungs, but also improves overall respiratory function. The lungs are equipped to absorb oxygen most efficiently when the air is at body temperature and adequately moist. This is a crucial factor in the respiratory cycle, as drier air can lead to irritation and inflammation of the respiratory tract, potentially exacerbating conditions such as asthma or chronic obstructive pulmonary disease, COPD. Additionally, nasal breathing encourages the production of nitric oxide, a molecule that plays a pivotal role in various physiological processes, including vasodilation, which is the widening of blood vessels. Nitric oxide is synthesized in the paranasal sinuses and, when inhaled through the nose, enters the lungs, where it enhances the oxygen-carrying capacity of the blood. This improved oxygen delivery to tissues is vital for optimal cellular function and can significantly influence overall health. Higher levels of nitric oxide are associated with improved cardiovascular health, reduced blood pressure, and enhanced immune response, making nose breathing a simple yet effective practice for promoting heart and vascular health. Moreover, the exclusive practice of nose breathing has profound implications for how our bodies utilize oxygen. When breathing through the mouth, we often inhale more air than necessary, leading to hyperventilation, which can result in lower levels of carbon dioxide in the blood. This imbalance can hinder oxygen delivery to tissues, as carbon dioxide is essential for the proper release of oxygen from hemoglobin in red blood cells, a phenomenon known as the Bohr effect. Conversely, nose breathing helps maintain an optimal level of carbon dioxide in the bloodstream, thus facilitating more efficient oxygen utilization. Nasal breathing also engages the diaphragm more effectively than mouth breathing. When we breathe through our noses, The diaphragm contracts and relaxes more deeply, promoting better lung expansion. This deeper diaphragmatic breathing not only increases lung capacity, but also enhances the exchange of gases within the alveoli, the tiny air sacs in the lungs responsible for oxygen and carbon dioxide exchange. As a result, the body becomes more adept at utilizing oxygen and expelling carbon dioxide, contributing to overall respiratory efficiency. Additionally, nose breathing can improve sleep quality by promoting more stable breathing patterns during sleep. Many individuals who breathe through their mouths experience sleep disturbances, snoring, and obstructive sleep apnea. By shifting to nasal breathing, individuals can experience deeper, more restorative sleep cycles, which are crucial for physical and mental recovery. Improved sleep quality, in turn, enhances cognitive function, mood regulation, and overall health. Moreover, the practice of nose breathing is intricately linked to stress management. Engaging in nasal breathing activates the parasympathetic nervous system, often referred to as the rest and digest system. And if you can perform deep diaphragmatic breathing, which is also known as abdominal or belly breathing, this is a powerful technique that significantly enhances lung capacity and improves oxygen intake, providing numerous health benefits. This method focuses on the full engagement of the diaphragm, a dome-shaped muscle located at the base of the lungs, which plays a crucial role in respiration. Unlike shallow chest breathing, which predominantly uses the upper part of the lungs and can lead to inadequate oxygen exchange, diaphragmatic breathing encourages deeper inhalations and more complete exhalations. This allows for a greater volume of air to enter the lungs, ultimately increasing overall oxygen levels in the bloodstream. The increased oxygen supply supports cellular function and energy production, which is essential for maintaining physical and mental performance. Engaging in deep diaphragmatic breathing effectively activates the parasympathetic nervous system, which promotes relaxation and reduces stress responses in the body. This activation helps counter the fight or flight reaction typically triggered by stress, resulting in lower levels of cortisol, the primary stress hormone. Chronic stress can lead to a myriad of health issues, including hypertension, weakened immune function, and digestive problems, making the practice of deep breathing a valuable tool for managing stress and enhancing overall well-being. Additionally, deep diaphragmatic breathing can improve lung function by training the respiratory muscles to work more efficiently. As individuals practice this technique, they strengthen the diaphragm and intercostal muscles, which support the rib cage. Improved strength and coordination of these muscles enhance respiratory mechanics, allowing for better ventilation and gas exchange. This is particularly beneficial for individuals with respiratory conditions such as asthma or chronic obstructive pulmonary disease, COPD, where effective lung function is paramount for maintaining quality of life. Plus, this breathing technique can positively influence cardiovascular health. By enhancing oxygen intake and promoting relaxation, diaphragmatic breathing can lead to improved heart rate variability, an important indicator of cardiovascular health. Higher heart rate variability is associated with better adaptability to stress and a lower risk of heart disease. Additionally, deep breathing encourages the dilation of blood vessels, improving circulation, and ensuring that oxygen-rich blood reaches vital organs and tissues more effectively.
By the age of 50, most people had lost 40% lung capacity. By the age of 80, most people had lost 60% lung capacity. Why is that? It's because they're not exercising. They're not moving. So if you have lost lung capacity, you can regain it by implementing the high-intensity interval training. If you have lost lung capacity, you can regain it quite quickly by stretching those lungs every day, breathing very, very deeply, which you automatically do when you do the high intensity. And if you do the high intensity every day, you will not lose your lung capacity. The lungs is where we take in the oxygen to feed that energy cycle inside the cell. And remember, that little energy cycle, when it has oxygen, it can give you 18 times more energy compared to a cell that does not have oxygen. Does this explain why so many people are tired today and have no energy? It's that lack of oxygen.
Practicing deep diaphragmatic breathing also has a direct impact on mental clarity and emotional regulation. As the body receives increased oxygen, brain function improves, enhancing cognitive abilities such as concentration, memory, and decision-making. This practice can also help mitigate anxiety and depression symptoms by fostering a sense of calm and stability through the physiological effects of deep breathing. When individuals engage in this technique, they often experience a reduction in racing thoughts and heightened emotional responses, facilitating a more balanced mental state. Apart from that, maintaining proper posture is a fundamental aspect of overall health, significantly influencing respiratory efficiency and lung capacity. Barbara O'Neill emphasizes that good posture plays a crucial role in maximizing oxygen intake, which is essential for optimal bodily function. When an individual sits or stands upright, the thoracic cavity expands, allowing the lungs to fill completely and efficiently. This alignment of the spine, head, and neck facilitates the proper functioning of the respiratory muscles, particularly the diaphragm, which is the primary muscle involved in breathing. In an upright position, the diaphragm descends effectively during inhalation, creating negative pressure in the thoracic cavity that allows air to flow into the lungs without obstruction. This contrasts with slouched or hunched postures, where the diaphragm's movement is restricted, leading to reduced lung volumes and less effective gas exchange. When the spine is misaligned, it can also compress the lungs and other organs, resulting in diminished lung capacity and suboptimal oxygen delivery to the bloodstream. The intercostal muscles, located between the ribs, also benefit from proper posture. These muscles aid in expanding and contracting the rib cage during breathing. However, they cannot function optimally if the rib cage is constricted due to poor posture. Moreover, maintaining an upright position can prevent the accumulation of tension in the neck and shoulders, which often occurs with poor posture. This tension can lead to restricted airflow, as the upper respiratory passages may become constricted when the neck is misaligned. Chronic tension in these areas can also contribute to the development of tension headaches and migraines, further compounding the issue of respiratory dysfunction. Proper posture not only aids in breathing, but also enhances circulation. When the body is aligned correctly, blood can flow freely through the cardiovascular system, ensuring that oxygenated blood reaches all tissues efficiently. This is vital for energy production, cellular repair, and overall health. The connection between posture and breathing is especially critical for individuals who engage in physical activities or sports. Athletes, for instance, rely on optimal lung function for performance. Poor posture can limit endurance, strength, and overall athletic capability, as the body struggles to oxygenate muscles efficiently. Engaging in activities that promote awareness of posture is essential for cultivating a healthier lifestyle. Mindfulness practices not only enhance core strength and flexibility, but also foster a deeper connection to breathing. These disciplines emphasize alignment and breathing techniques that encourage full lung expansion, thus reinforcing the relationship between good posture and effective respiration. Apart from that, regular exercise strengthens the muscles responsible for maintaining good posture, such as the core, back, and shoulders. Strengthening these muscles can help combat the effects of prolonged sitting, especially in environments where people spend hours at desks, leading to the development of poor postural habits. Learning about ergonomics is important for keeping good posture, especially at work. Adjusting your desk height, computer screen, and chair can make a big difference. Small changes, like using a chair with good back support or standing while working, help your body stay aligned, which also improves how you breathe. Barbara O'Neill suggests taking regular breaks to reset your posture and relieve tension. Even simple stretches or walking can improve your posture and breathing over time. In addition to all these, exercise is necessary. It plays a crucial role in enhancing the efficiency of the respiratory system by elevating the body's demand for oxygen. When engaging in physical activity, whether it be aerobic exercises like running, cycling, or swimming, or anaerobic activities such as weightlifting and sprinting, the body experiences a significant increase in its oxygen requirements. This heightened demand compels the respiratory system to adapt by improving its ability to deliver oxygen to the bloodstream, thereby optimizing overall oxygen utilization.
And then just changing the way that you breathe can have a dramatic effect, all because of nose breathing. You may find it very hard at first to exercise and only nose breathe, but I've got some good news. You'll get better at it. I do it now, and even this morning when I ran up, my 30 seconds run up the hill, my body wants me to go, but I know I'm not going to get any more air into my cell, which is what is going to give me the energy. But you can do it. On Saturday morning, I'll show you how you can rewire your brain, and you can be rewiring your brain right up until the day you die.
The physiological mechanisms that underpin these improvements begin with the increased heart rate during exercise, which elevates blood circulation and enhances the transport of oxygenated blood to various tissues and organs. This, in turn, stimulates the alveoli, the tiny air sacs in the lungs responsible for gas exchange, to become more efficient. As the lungs work harder, their surface area for oxygen absorption expands, allowing more oxygen to diffuse into the bloodstream, which is crucial for cellular respiration and energy production. As regular exercise is practiced, the respiratory muscles, including the diaphragm and intercostal muscles, become stronger and more resilient. Increased endurance in these muscles allows for deeper and more forceful breaths, further enhancing the volume of air exchanged during inhalation and exhalation. This efficiency is critical during physical exertion, when the body requires rapid and significant increases in oxygen intake to meet energy demands. In addition to that, the lungs undergo structural adaptations over time, increasing their capacity and efficiency, which results in a higher maximum oxygen uptake, commonly referred to as VO2 max. This measurement is a key indicator of aerobic fitness and is closely associated with an individual's endurance and overall health. In addition to structural and functional improvements in the lungs, regular physical activity stimulates various biochemical processes that contribute to better oxygen utilization. Exercise triggers the release of hormones such as epinephrine and norepinephrine, which facilitate increased oxygen transport and utilization at the cellular level. As muscles engage in prolonged activity, they enhance their ability to utilize oxygen through increased mitochondrial density, thereby improving aerobic metabolism. These mitochondria are the powerhouse of the cells, where aerobic energy production occurs, and a higher density results in greater ATP production, which fuels muscle contractions. Moreover, engaging in regular physical activity also positively influences the cardiovascular system. A stronger heart pumps more efficiently, meaning it can deliver more blood, rich in oxygen, to working muscles during exertion. Enhanced cardiovascular efficiency means the heart can maintain adequate blood flow even at lower exertion levels, allowing for more sustained and prolonged physical activity without excessive fatigue. This cardiovascular adaptability is critical in reducing the risk of chronic diseases such as hypertension, coronary artery disease, and stroke, which can be exacerbated by a sedentary lifestyle. Additionally, regular exercise has profound effects on the regulation of oxygen consumption during various intensities of physical activity. It enhances the ability of the body to maintain adequate oxygen levels even in hypoxic conditions, such as during high-intensity workouts or in high-altitude environments. This adaptation is particularly beneficial for athletes, as it enables them to perform at higher levels for longer durations without succumbing to fatigue. Notably, exercise also promotes the effective removal of carbon dioxide, a byproduct of aerobic metabolism, from the body. Improved respiratory efficiency during physical activity aids in the rapid clearance of carbon dioxide from the bloodstream, preventing the accumulation of this gas, which can lead to respiratory acidosis and fatigue. The regulation of carbon dioxide levels is essential for maintaining optimal pH balance in the blood, further emphasizing the interdependence of respiratory and metabolic processes during exercise. Moreover, the benefits of regular physical activity extend beyond the physiological realm into the realm of mental health. Exercise has been shown to enhance mood and reduce symptoms of anxiety and depression, partially through the increased delivery of oxygen and nutrients to the brain. This oxygenation improves cognitive function, enhances focus, and bolsters overall mental clarity, making it an indispensable component of a holistic approach to health. And last but not least, staying hydrated is essential for maintaining overall health, particularly in the context of oxygen transport within the body. Water constitutes approximately 60% of the human body and plays a vital role in various physiological processes. Proper hydration is crucial for optimal oxygen transport because it directly influences the production and function of hemoglobin, the protein in red blood cells responsible for carrying oxygen from the lungs to tissues and organs. Hemoglobin is composed of globin, a protein, and heme, an iron-containing compound. The availability of water is critical in the synthesis of hemoglobin, as adequate hydration aids in the effective production of red blood cells in the bone marrow. Dehydration can lead to a reduced volume of blood, increasing blood viscosity, which in turn can impair oxygen delivery and create a strain on the cardiovascular system. In addition to its role in hemoglobin production, water facilitates the transportation of nutrients and oxygen to cells while simultaneously assisting in the removal of metabolic waste. Hydration affects blood plasma volume, which influences blood flow and pressure. When the body is dehydrated, blood becomes thicker, requiring the heart to work harder to pump it, leading to an increased heart rate and potentially elevated blood pressure. This can result in diminished oxygen delivery to vital organs, which is particularly concerning during physical exertion or in individuals with pre-existing cardiovascular conditions. Adequate hydration helps maintain the ideal viscosity of blood, ensuring efficient circulation and oxygen transport, which is critical during aerobic activities that demand higher oxygen levels, such as running or cycling. Moreover, hydration plays a crucial role in maintaining cellular homeostasis and regulating body temperature. Water helps dissipate heat through sweat production, a process essential for thermoregulation, particularly during intense physical activity. When the body becomes dehydrated, the ability to sweat diminishes, impairing the body's ability to cool down effectively. This can lead to overheating, increased heart rate, and potential heat-related illnesses, which can compromise oxygen delivery as the body struggles to maintain an adequate supply. Additionally, optimal hydration supports the functioning of the kidneys, which filter waste products from the blood and help regulate electrolyte balance, both of which are vital for maintaining the body's overall fluid balance and ensuring that oxygen delivery systems function optimally. Water also serves as a lubricant for joints and a protective barrier for organs and tissues, further highlighting its significance in maintaining physical performance. Joint health is critical for those engaging in regular physical activity. Dehydration can lead to joint stiffness and discomfort, impacting mobility and the efficiency of oxygen utilization during exercise. Proper hydration ensures that synovial fluid, which lubricates joints, remains at adequate levels, facilitating smoother movements and reducing the risk of injury. On top of that, the relationship between hydration and cognitive function cannot be overlooked. Dehydration can lead to cognitive impairments, including decreased concentration, increased fatigue, and diminished short-term memory. When the brain is not adequately hydrated, its ability to function optimally is compromised, affecting decision-making processes and overall performance. Since cognitive tasks often require significant oxygen supply for efficient neuronal activity, insufficient hydration can detrimentally impact mental clarity and focus, which are essential for executing physical activities that require coordination and precision. Barbara O'Neill emphasizes the importance of understanding the signs of dehydration, which can range from thirst and dry mouth to more severe symptoms like dizziness and confusion. These signals indicate that the body is already in a deficit, stressing the necessity of proactive hydration rather than reactive measures. So, which breathing secret resonated with you the most? How will you incorporate these techniques into your daily life? Share your views in the comments below. But what's more important than breathing secrets to resist cancer is how we approach any cancer. As Barbara O'Neill says, the chemotherapy, the treatment, and the medications the big pharma companies recommend are actually a big fluff with insane side effects. But do we have a better choice then? She says, yes. There are other ways that the conventional medical system doesn't want you to know. But if you want to know about it, click on this video and watch. This is eye-opening. Don't forget to like, subscribe, and share this video to spread the word about the power of breath. See you soon.